Hello again, everyone. Mark Macomb, Macomb County Executive. John Paul Rea, Deputy Executive here. Just giving you the update, what's going on with the COVID crisis here in Macomb County. JP, what do we got as far as some of those numbers there?
Mark, this week we continue to see rises in the numbers, as we've said, is going to happen every single day that we get up, but a number of positive trends which we want to report to folks this morning. When we look at it countywide, about 6,700 cases, unfortunately 789 deaths. The good news is over 5,000 individuals have officially recovered from the coronavirus here in Macomb County alone. Statewide numbers continue to rise when we're looking at currently about 56,000 total cases reported from the state and about 5,300 deaths statewide. But again, some new metrics coming out, some new dashboards which are illustrating some really positive elements of there from the county's level.
Yeah, as JP mentioned, we're going to put up a, if you will, kind of a metric, a dashboard of sorts to take a look at here. And I think it's, we're trying to get away a little bit from the total numbers. I think, as JP just mentioned, they're going to continue to rise, whether it's globally, nationally, statewide, and obviously here in this county. And, it just seems to be, the trend. I mean, it's not going to go away. So we know the numbers are going to continue to rise, and you can find all those numbers, and you're going to see it based upon our summary at macombgov.org. You're here right now watching the video. Just take a look at those numbers, and you'll see it based on community, and you can kind of see the actual graphic nature of it as well. But looking at this chart that we're going to put up here, if you take a look, you'll notice this is something that's very interesting, and I say it for this reason. The main objective at the beginning was to figure out how we flatten the curve, lessen the number of cases, lessen the number of deaths. Well, at a point in time when we were averaging here in Macomb County about 30 deaths a day, it's incredible how far we've come. Now we're averaging only 1.3 deaths per day. Obviously, any death is something that's tragic, and we want to figure out how do we get to a point where, this is, I guess, if you will, the medical community is able to do something to come up with a vaccine. But for the most part, this is well beyond, I think, the expectations we talked about for healthcare providers, the hospitals. We have flattened that curve incredibly. 1.3 per day, when we once upon a time we're looking at about 30 a day. So over the last 7-day period, 1.3 deaths. And if you compare that to our counterparts throughout the region, Wayne County, they're 5 per day, Oakland County 2.6, and Detroit 3. Now let's look at the cases per day, per million people. If you take a look at our average used to be about 200 per day is what we're looking at. And here we're now looking at 15.6, only 15.6 cases per day. Again, flattened the curve. And you can see obviously the resulting figures in our counterpart or communities surrounding us as well. But now there's a new metric. And this is the challenge that we're facing right now when it comes to opening the economy, or some of the decisions that we have to make here in this county to meet, because the new criteria has come into play. So the new criteria now is the percentage of the population that tests positive. What do I mean by that? People that are now taking this test, and once upon a time we were told you had to have some type of symptoms, not feeling good, and before you could take the test. Well, obviously most of those people, or many of those people I should say, were going to test positive. We're still continuing on that path. And now we've been told by the governor that the requirement to open up certain sectors of the economy, or loosening that, or I guess change some of the stay home, stay safe orders, is dependent upon that percentage of people who test. That is something completely new to us. And unfortunately, it puts us at a disadvantage, because most of the people we were testing were people that showed symptoms. And it's almost like now I got to encourage people that are healthy to take the test to help us drive that number down. It doesn't seem appropriate, but that is what's happening, and it's happening around the region. We're seeing that they're opening it up for testing for people that want to take the test. So we're going to start doing that here in Macomb County. I know CVS has some locations where people can go ahead and get tested. But it seems like we're doing that just to kind of chase the numbers, and that shouldn't be the case. The numbers are significantly low when it comes to the number of deaths, significantly low when it comes to the number of cases, but now we're working out the percentage. Just recently we had to enact something with our health department dealing with the pools. And again, people that have homes, they have their own pools that are not licensed, or I should say inspected by the health department. This doesn't apply, but it does apply to those that have to have their pools inspected by a health department. We did that with our regional partners. Understand that this is going to be in place until this next round of governor's orders, or her new executive order, stay at home, stay safe order, which would be June 13th. So what we're telling those that this does apply to, our health order, is by June 13th, you pretty much can open your pools, but you're going to have to make sure you've gone through those inspections with the health department and continue to follow what other guidelines may come out from the governor's order. So this is temporary. This temporary order that we have in place will be restricted until June 12th. But in the meantime, those that have pools, whether it's an apartment complex, if maybe a marina, somebody within a condo association, if you have a pool that usually and normally has to be inspected, please get a hold of the health department to have your pool inspected and be prepared by June 13th to open with the restrictions that are put in place by governor's orders as opposed to our health department. So interesting enough, I mean, now we're trying to figure out how do we satisfy some of the new restrictions based upon the numbers or percentages of people who are testing as opposed to what the original plan was, and that was flattening the curve.
Mark, a number of factors that we're going to continue to have to juggle, not only with our public health experts as we take guidance from them, understanding what may be some of those areas where we need additional clarification or we need to ensure that we have enough staff in place to support those things, whether it's analyzing pools, whether it's looking down the line to larger social gatherings, whether it's festivals coming into the summer months and things like that. These are all metrics that we're discussing not only with our regional counterparts, but trying to kind of balance all those guidelines that come in and really understand what is the most safe environment we can put individuals in with the most support that we can get from the system here in county government. It's not putting about like more and additional restrictions on folks and everything. It's ensuring that we're working with the public, getting them the initial support that they need, and ensuring that we can sustain the response.
Yeah, because we've been throwing a new criteria, and so now we're trying to figure out how do we get lower than what the original criteria was. I mean, it's pretty incredible the work that's been done on behalf of the public, on behalf of government entities in Macomb County and our businesses to get to where we're at. But now being thrown this new criteria, we have to figure out how do we comply with that and how do we make that happen or manage it. So, some of the things that we're going to have to do to try to get there, I don't personally think are probably the best thing to do or the right thing to do. Making people test that are otherwise healthy, again, it is what it is, and we're going to have to deal with that. But interesting, you mentioned about the fact that our regional counterparts, we are actually in a region that consists of 9 counties.
Correct.
And so before we can open as a region, we have to have a percentage down below whatever that standard is for the next phase. And again, I continue to make an appeal to the governor to allow some of these healthcare clubs to open up, to allow some of the barbers and the hair salons, give them a chance, tanning salons, an opportunity to open up. They'll comply with the guidelines. They're prepared. They can handle this. And based upon the initial, criteria, we fell way below. I believe they're going to be responsible enough. And those that don't want to open don't need to open. People that don't want to go to those facilities because they still feel unsafe don't need to. But on behalf of some of these folks that are out there looking to get back into business, boy, I'm appealing to the governor to take a look at it and really rethink maybe some of the criteria that's been put in place here.
Yeah, Mark, it's been a really refreshing conversation as we've engaged a lot of businesses throughout the county that want to be part of that solution. They're not only working with us, whether it's exploring how we get them additional PPE and other resources, how we can clarify different elements, whether it's from a regulatory agency or it's specifically from the governor's executive orders. I think the other thing that's really helpful too is as we put our CARES Act funding plan in place, as we're continuing to work with all those partners, there's additional relief that's going to be coming down the pipeline, which we're really excited to be able to put those parameters together. We're going to have some additional information out next week about those programs, and then some larger announcements in the following weeks too.
Yeah, as JP had mentioned, we're working in particular with some of the, the dentists are really concerned about getting some of the PPE. We were able to take care of that. We're also working with those other companies. We're going to make an announcement next week, try to get those that are looking for PPEs to get started or get up and running, how they can do that. And so we'll have that information available. We'll talk about it next week, and we'll also have the availability of people to sign up for it that need it, companies or businesses, as well as the funding. That may be another week or two off, but we will be getting information as to how you can apply for some of those funds that we have available through the grant. And again, the CARES funding was substantial, and we are going to be able to help out some businesses to some extent. And again, we'll make the announcement with the specifics later next week.
Excellent. Yeah, that's going to be, again, a continued conversation. But again, our effort here out of the Emergency Operations Center, with all the support that we're getting from the Department of Health here in Macomb County, obviously from all the other folks that are in here with the initial response to this COVID, is getting the public sentiment, ensuring that the resources are here locally, and deploying a strategy that will help us phase back in different elements of not our economy and society in the safest way possible.
Yeah. So again, we're fortunate here in Macomb County. People are abiding by it, social distancing, listening to the CDC guidelines. We've done a great job of getting to where we need to get to open the economy. It's just a matter of waiting to see what's going to come out of the next executive orders. We're going to continue to try to figure out how do we work with our businesses as well as our communities, because everyone wants to try to figure out how do we put our best foot forward to try to keep everyone safe. And again, I always say this, and I qualify it with people: if you're elderly, if you don't feel comfortable venturing out, you've got other underlying health issues, you don't need to go out. You don't need to go anywhere. Continue to stay home. Again, there's support that we can provide from a county, whether it's food programs and or obviously some of the other necessities. We'll try to help out with that. But in the meantime, on behalf of JP and myself and the rest of us here in Macomb County, we want to thank you for tuning in. We want to thank you for being part of the solution, and we want to remind you to keep you and your family safe.